Thank you for your kind introduction, Chairman. Good afternoon, good morning, everyone. My name is Jimin Kim, and I'm from Department of Radiology of Eunpyeong Mayor Hospital in Korea. In this presentation, I will talk about my current research that compared the two commercial brain volumetry software, and I want you to understand this study as an example of an approach to volumetry research. And this slide is disclosure about the funding and support I have received regarding this research. And I have research funds supported by the support center of Eunpyeong Mayor Hospital. So then let's officially get started. As the worldwide population ages, neurodegenerative disease, including Alzheimer's disease, are rapidly becoming more prevalent. And this figure shows estimated annual % change in 204 countries and territories. In this figure, the more red appears and the higher the incidence increases. So here, Vietnam and Korea can see that the disease is increasing at a relatively moderate rate. But in many countries, for example, China, the Alzheimer's disease is increasing rapidly. And many studies have shown that atrophy of the hippocampus is associated with Alzheimer's disease. So recently, it is recommended to take structural brain MRI to diagnose the Alzheimer's disease by many associations. But diagnosing Alzheimer's disease is still challenging. Since revised guideline was published in 2011, the medial temporal lobe atrophy has been considered as the all-imaging biomarker utilizing brain MRI in diagnose the framework for Alzheimer's disease. However, visual assessment of brain atrophy represented by Shelton scale showed high intra-observer variability and low sensitivity. Therefore, to overcome the potential shortness of qualitative measurement, various commercial volumetry software has been developed. This software can quantify brain volume and provide an age-appropriate percentile based on normative database. For instance, these software are the examples of the volumetry software. This table is actually extracted from the Korean recommendation guidelines for brain volumetry software application published in 2020. So to validate the volumetry software, there should be solid strategy. The Korean Society of Radiology recommended several guidelines to validate volumetry software. The first is the reliability and repeatability of repeated tests to see if the same quantitative analysis results are obtained when one patient is shot on the same machine at short interval. The other one is the reproducibility between devices that produce the same images when taken on different MRI machines. Finally, it is reproducibility between different observers and analysts who checked whether the same quantitative indicators appear in post-processing and analysis through software. These items can be seen as the repeatability and reproducibility of the image itself, and the fourth item can be seen as a reproducibility of the image post-processing quantification analysis. Quantification analysis mainly emphasizes reproducibility between clinical software that performs image post-processing, quantification, analysis, and repeatability and reproducibility of MRI themselves are also important. So in these circumstances, NeuroQuant has been the most widely used clinical software and has been relatively verified through various studies since 2009. As a web-based quantification analysis software, results of NeuroQuant can be obtained within about 5 to 10 minutes. This is related to the method of presenting the volume of the entire white and gray matter instead of representing each brain gyrus. Results report can be immediately available from POCs and show normal standard percentiles comparing patient data to normative database. NeuroQuant presents the total brain volume and 11 sites volume for both sides, respectively. However, Aqua has not been validated and its clinical setting unlike NeuroQuant, which is one of the most validated volumetry software in the world. And NeuroQuant is actually a spin-off of Philosopher, a software with a research focus used for volumetry. Philosopher is a software package for analysis and visualization of structural and functional neuroimaging data from cross-sectional or longitudinal studies. It is developed by the Laboratory for Computational Neuroimaging at the Attinola Marteos Center for Biomedical Imaging. Philosopher is a structural MRI analysis software of choice for the Human Connectome project. The steps of the NeuroQuant process were as follows. The process involves removing the skull and meninges, and inflation of the brain to a spherical shape, and mapping the sphere into a shared spacing using the Thalaric Atlas coordinates, identifying the segmented brain areas, and then contracting the brain back to its original shape. And this is actually the diagram of the ACUA neural network. ACUA is also built on Philosopher using split attenuation unit, or SAUNet. A convolutional neural network with skip roots and a split attention module that separates brain MRI images. This figure is SAUNet of overall architecture and modified convolutional network. And two open sources and free research sites provided a wide variety of cognitively normal station population normative MRI data of ACUA. This figure is about data sets used in the study shown by their source and their usage. The 97 different regions of the brain are divided up by ACUA, which also examines structural details like atrophy, structural alterations, anatomical asymmetry, and white matter abnormalities linked to degenerative brain illnesses. The process steps of ACUA were as follows: skull stripping, tissue classification to extract brain tissue compartments such as white matter, gray matter, and intra-extraventricular CSF. And basically, process of the volumetry analysis is following next step. MRI images were sent to server, processed, and sent back to POX. Then we can finally see the results of the volumetry analysis. Of course, there can be different process according to software, hospital environment, or other circumstances. And I want to humbly introduce one of my research regarding this volumetry software applications which validate the volumetry performance of ACUA, NeuroFit, and NeuroQuant. Therefore, the object of our study was to compare the calculated mean volume of two commercial volumetry software in non-Alzheimer's disease and Alzheimer's disease groups. Also, we compared correlation between mean quantitative hippocampal volume of each software and Shelton's scale. Because correlation between Shelton's scale is also an important factor to validate the performance for volumetry software. From January to August 2021, 203 individuals who underwent brain MRI and visited the neurology or neuropsychiatry departments of our hospital's neuroscience center for subjective memory impairment or transferred from a community mental health center were enrolled as a potentially eligible participants. To determine whether participants had Alzheimer's disease, clinical evaluations were conducted using the Korean version of mini mental state examination, or KMMSE, and the clinical dementia rating, or CDR. The dementia specialists diagnosed and classified the disease groups into subjective cognitive impairment, or SCI, mild cognitive impairment, or MCI, and Alzheimer's disease. 17 samples were also excluded because the patients were diagnosed as other than disease, such as ACI, MCI, or AD by clinicians. Two clinicians classified participants with SCI and MCI into non-AD group, and the other participants with Alzheimer's disease into AD group. All brain MRI examinations were reviewed by 3 neuroradiologist reviewers, and they excluded 59 samples that presented focal brain lesions or severe artifacts which could interfere volumetry analysis of each software. Each participant underwent a 3 Tesla MRI using 64-channel head and neck coil, which was manufactured by Siemens. And sagittal T1 weighted volumetry and purage images were obtained with the following parameters. All MRI examinations were analyzed by NeuroQuant and Aqua volumetry software. Each participant underwent 1 MRI examination, including sagittal volumetric T1 weighted images. And these images were uploaded to separate NeuroQuant and Aqua servers for automated volumetry analysis. After completion of analysis, the volumetry results of each software are sent back to POCs of our hospital. The system displayed the volume percentile based on normative database and the proportion of volume to the total intracranial volume of brain substructure, and colored images of each software. And these pictures are example of the NeuroQuant volumetry results. And these pictures are example of Aqua volumetry results. This figure about T1 weighted axial MR images that showed conventional axial images at the basal ganglia, which is presented as A image, and color-coded images of NeuroQuant and Aqua, respectively. And this is the result. Total 127 samples were enrolled. The number of the non-AD and AD were 54 and 73, respectively. The samples of AD groups showed significantly older ages with lower KMMSE and higher CDR scores than non-AD group. And considering clinical diagnosis, most brain regions showed significantly differences of mean volume, except for the parietal lobe, which is colored in black color. We also assessed the inter-method reliability between the 2 software utilizing the Pearson's correlation and interclass correlation coefficient. In the terms of Pearson's correlations, the most brain regions exhibit statistically significant volume regardless of the clinical diagnosis. These regions showed moderate to strong linear correlation across all groups. In the terms of intraclass correlation, most brain regions showed moderate to strong intermethod agreement in intraclass correlation, except statistically insignificant data, which were colored in gray. These figures showed intermethod reliability between 2 software and showed very strong linear correlation regardless of the clinical diagnosis. And Aqua showed larger volume than NeuroQuant overall. For subanalysis, correlation with Shelton score showed weak correlation of NeuroQuant and moderate correlation of Aqua. So to sum up the results I have shown, overall mean volume showed that calculated Aqua was larger than NeuroQuant. Overall intermethod reliability between 2 software showed very strong, moderate to strong reliability. And correlation with Shelton scale of Aqua and was superior to NeuroQuant. But when we think about why there is a difference between the 2 software, there can be a number of potential causes. The different baseline anatomic atlases between NeuroQuant and Aqua could be one of the causes of because NeuroQuant and Aqua were developed with the Telluriac Atlas and Desikan-Kiliani Atlas, respectively. Therefore, these results could be potential dilemma for clinicians to choose which volumetry software when there is a demand for acquiring quantitative volume of the brain substructure. And ethnicity difference of implementing normative reference database because the brain morphology and Asian population could be affected by ethnicity potentially caused by geographic environment. This could be a substantial cause for different results between 2 software. Also, the different anatomical definition of hippocampus across the software could be another potential reason. In this process of development and establishing gold standard by manual segmentation, different anatomical boundaries and tracing procedures can provide substantial volume difference. Therefore, to conclude our results, ACUA showed significantly larger volume than EuroQuant, and EuroQuant and ACUA showed moderate to strong correlation. However, in the terms of Shelton scale, ACUA showed better correlation than EuroQuant. And the clinician should consider these factors and limitations when to select the volumetry software and interpret the results. And I think I'll wrap up the presentation here, and thank you for your attention. Thank you.